really excited to be here with you today to share our work that has spanned the last 3 years at ASCO GU. The first year we talked about the development of this measure, and it's called the Functional Assessment of Cancer Therapy for Radionuclide Therapy, or FACT-RNT. It's important that it was built into this really rigorous library of measures that can be drawn from for clinical work, for research, in particular, clinical trials even. And it's accessible now as we speak. We wanted to then go on to test the kind of rigor of this measure from a reliability standpoint and a validity standpoint. Last year, we were able to establish reliability, that there's internal consistency of the measure, that it really performs consistently across time and across patients. And then this year, we really talked about the validity of the measure, in that if you were to administer similar measures, the FACT-P, or there's another measure that we were comparing against, could we say that they perform pretty similarly, that the symptoms are being assessed in a somewhat similar way, although we have unique items and ways of measuring for our measure? We did find that it was valid, at least in the initial patient population that we were testing. And an added benefit of this year's presentation was to start talking about implementation. Can this be used in clinical practice? And that's what we're attempting to do here at Moffitt. We've already started providing this measure for patients who are coming in for each of their infusions. They're often, for some of the radionuclide therapies, they might be across multiple weeks, that they have infusions every few weeks. And we want to, at every infusion, be able to assess if their symptoms have changed, or if we should be concerned before they receive the infusion at that time. So it's a really great way to see our work in action, and to sort of demonstrate that this can be useful for clinical trials in which it's being used across the world, and in clinical practice like it's being used at Moffitt. The work that we presented on at ASCO GU this year, and for the past 3 years actually, has been focused on a patient-reported outcome measure that we developed for prostate cancer, specifically for patients with metastatic castrate-resistant prostate cancer, and those who are receiving radionuclide therapy. So it's a newer therapy that has been used in clinical trials and in clinical practice in recent years. And we wanted to make sure that there was a very tailored patient-reported outcome measure that assessed symptoms and quality of life in this patient population, so that we could hear from the patients themselves and how they're doing, how they feel, what their symptoms are, and how it's impacting their quality of life. So our team had the privilege of developing this patient-reported outcome measure, which is a way of assessing patients' direct report of symptoms and quality of life concerns in a survey format. So they're able to report to us which symptoms they're experiencing. It's a brief measure, 15 items, and we wanted to be able to ask directly, are you having xerostomia, which is dry mouth? Are you experiencing other really specific symptoms that they can then endorse how severe those symptoms are, or if they're experiencing them at all? In the end, we're able to provide a total score that kind of gives us an indication of their overall quality of life. And we've called this the Functional Assessment of Cancer Therapy, Radionuclide Therapy, or FACT-RNT. The other part of this is that it's a very standardized way of asking, making sure we're asking a comprehensive list of symptoms. So although we may have a subset of symptoms we tend to ask about, there are a number of symptoms that could be experienced by someone who's having this type of treatment that we may not usually capture. And it would give us a good opportunity to get a comprehensive, quick read on that, versus having a conversation. To start off, you have this survey data to go off of, which can initiate the conversation about what they report. And across patients and across clinics and across countries, now we have a standardized way of asking this, and it gives us some really rich data on what patients are experiencing in different settings, depending on how it's administered, when it's administered, and what patients are coming in with when they're being treated. To ask patients directly is really important. That's a lot of the work that we do, because although we as clinicians may feel we know our patients very well, we ask good questions, our perception of what they're experiencing may not always align with what they would tell us directly. So we want to make sure that in addition to clinician-reported outcomes or things that clinicians are assessing and reporting in our clinical notes and in clinical trials, we also want to know, is there something we didn't ask, or is there a severity level that we're not aware of? We don't really have a good sense of what they're experiencing unless we ask them and give them a voice. So we want to make sure that both are being captured, especially in instances where they may be discrepant. We're feeling very optimistic that this measure will have an impact on future research and clinical work. We especially are excited to see how it's being used in clinical trials across the world at this time. Many different trials are using the FACT-RNT, and it will give us a lot of useful information to know how how the treatment is impacting patients across time, across different treatments even. Those treatments are changing even as we speak. It's a really ever evolving field. And I think it will be helpful for us to understand how the symptoms evolve with the different treatments. We know that there are different types of treatments that have different symptom kind of impacts, more or less impacts. One symptom in particular that we are tracking is xerostomia, or dry mouth, which is a really common symptom experienced by the earliest sort of radionuclide therapies. And it can be treatment limiting at times. So we really want to understand who's experiencing this, when is it being experienced, what does it affect, and do the newer treatments do a better job in terms of not impacting salivary glands and not giving patients such severe dry mouth. That will be an interesting one facet of the outcomes of all of what we can learn from FACT-RNT. So I think it's going to give us a lot of really rich data to learn about the treatments themselves and to innovate treatments as they continue to come out. And the clinical side, I think it will really give us a more standardized, kind of rigorous way of measuring symptoms pre-post infusions, and making sure that we are tracking what's going on for patients.